If a patient has been diagnosed with breast cancer, a doctor may want to perform a sentinel lymph node biopsy for several reasons: to determine if cancer has spread beyond the breast via lymph nodes, and to decide appropriate systemic treatment based on this information. Our story begins in the lymphatic system. Our body contains two separate systems for transporting fluids: the circulatory system for blood and the lymphatic system for lymph fluid and lymphocytes. The lymphatic system serves many functions, including the initiation of immune responses, fluid transport, and the filtration of foreign material such as bacteria. The lymphatic system is also where cancer cells can drain and collect. If found here, it is an indication that cancer cells have spread elsewhere in the body. Lymphatic fluid bathes the breast, then drains through lymphatic channels directly into one or more lymph nodes, known as sentinel lymph nodes. If a patient is diagnosed with cancer, it is important to know if the cancer has spread beyond the location where the cancer originally developed. To do this, a surgeon can perform a biopsy, where these sentinel lymph nodes are removed and examined. If cancerous cells are found in these lymph nodes, that means the cancer has spread and requires systemic therapy. Sentinel lymph node biopsy technique. One technique a radiologist or nuclear medicine doctor may use to locate the sentinel lymph nodes involves the use of a tracer dose, or tiny amount, of a radiopharmaceutical. The amount of radiation it contains is minimal and safe, both for the patient and for the people in close proximity to the patient. Prior to the procedure, a medical professional will inject the radiopharmaceutical into the patient's breast around the tumor or superficially in the skin around the areola. The surgeon often will inject blue dye once the patient is in surgery. The dye will flow through the lymphatic system into the lymph nodes. The breast may be gently and briefly massaged to help disperse the radiopharmaceutical and the blue dye. The surgeon will scan the region of the sentinel nodes using a device such as the Neoprobe gamma detection system to detect where the radiopharmaceutical has collected. The gamma detection device makes an audible sound when it detects the radioactivity in the sentinel lymph nodes. The skin overlying the radioactivity in the sentinel lymph nodes is marked with indelible ink to guide the surgeon to where to remove the sentinel lymph nodes. Then, an incision is made. Next, a surgeon will insert the probe tip into the incision to more precisely locate the targeted lymph node tissue, checking the gamma detection device screen as well as hearing the audible tone from the device. If blue dye was injected, the surgeon may also see that the targeted lymph node is blue. The surgeon surgically removes the sentinel lymph nodes, often using the probe to do one final check that the targeted lymph nodes have been removed. The removed lymph nodes are sent to the pathology department for examination. This examination confirms whether or not cancer cells are in the lymph nodes. This is important in determining the appropriate treatment of the patient's breast cancer.